You may need a lie down after hearing this and some smelling salts. The Telegraph report that the NHS is currently paying six-figure salaries to 3,500 managers. Statistics from the Department of Health and Social Care also show that the number of senior bureaucrats employed by the service has risen by 16% in just 3 years. There are now over 36,500 bureaucrats within the NHS, up from 33,000 in December 2019. How can our health service, which is paid for from the public purse, your money and mine, sleepwalk into hiring thousands more people on huge six-figure salaries? There aren't too many examples in the private sector of people being recruited and the wage bill exploding accidentally or without anyone really noticing. In the private sector, the wage bill doesn't swell automatically. But when you and I are paying for it, it's another story. As with the entirety of the public sector, when it's taxpayers' money, we're always taken for mugs. We know about the diabolical waste in the health service, with hospital trusts paying over the odds for a packet of paracetamol that you can buy for 50p at Morrison's. There are contractors charging a small fortune to change a light bulb or replace a carpet tile. And don't get me started on diversity officers for the most diverse workforce on God's earth. The public sector has a problem with cash. Whilst private companies work ruthlessly to police their incomings and outgoings, and with the very survival of the business dependent on the balance sheet and the bottom line, in the public sector, when it's taxpayers' money, it's money no object. It's often boasted that the NHS is the biggest employer in Europe. It's the biggest employer in Europe. Why is that a boast? That, in my view, is an admission of its outrageous inefficiency. The NHS should treat more people and employ fewer. Yes, we need more doctors and nurses, absolutely. But pen-pushing middle managers, not so much. Whoever wins the next election must conduct an almighty war on waste. And the best place to start is these fat cat salaries for NHS managers who have presided over a service which is getting both more expensive and worse by the day. And these NHS managers, as part of the leadership of our health service, were behind the NHS's, in my view, disastrous response to COVID, in which it focused on the containment of a seasonal respiratory virus at the expense of far worse illnesses like cancer, type 2 diabetes and dementia. Even now, when you go into an NHS hospital, they're still drinking the COVID Kool-Aid with ridiculous signs for social distancing, plastic screens everywhere, and half the staff wearing those filthy, worthless face rags. I hasten to add, many of them just wear those masks on their chin or below their nose. Follow the science. Now, with mask mandates, with a focus on containing the spread of COVID within hospital settings, the NHS would argue they were trying to save lives and prevent the service from being overwhelmed. I understand they were doing their best, but I beg to differ in terms of strategy, as perfectly healthy doctors and nurses were forced to stay at home for weeks on end during the pingdemic, when their phone alerted them after they'd been in contact with someone that, horror of horrors, had tested positive for COVID. Yes, COVID was a potentially nasty virus, but one mild and non-fatal to almost everyone. Well, thanks to the COVID hysteria, encouraged by fat cat NHS middle management, the NHS is certainly overwhelmed now. These six-figure middle managers are responsible for a waiting list of over 7 million people and a health system on the verge of collapse. Please don't mention money, given the fact that the health service is estimated now to cost each household in the country £13,000 a year. Now, I'm not saying this is a good thing, but you could pay a fraction of that to go private. NHS managers have presided over a service in which the population is getting iller and fatter by the decade. Until you tackle public health and obesity, which is a gateway drug to every other illness you can think of, the service will never be viable. The nurses and the doctors are great, but the once-envied National Health Service is becoming an expensive joke. It's enough to make you sick. What's your view? Do you agree? Do you disagree? Mark at gbnews.uk. As I've said, the NHS would argue they need those middle managers. They've got to pay top dollar. Without them, people would die. The health service would be worse. Many of these middle managers, it's argued, work miracles every day to get people their operations and to keep a Byzantine system going. But what's your view? Let me know. This show's all about opinions.